Welcome, viewers. We're so glad you're here. My name is Marcy Gruby. I'm the Director of Integrated Sales and Marketing with Shelters United. Thank you so much for taking time to join us for this super important session. This is a recorded education session called Don't Be a Walking Germ Taxi. It's Disease Defense 101 for shelters and rescues. So again, we're so glad you're here and taking time, no matter what your role is in your organization. You are totally welcome here, and we're excited you're watching. You're in great company because there's shelters and rescues and foster-based groups all across the nation who will be watching this. So again, we're just excited you're here and taking time. I am going to introduce our lovely speakers who I'm so glad are here today. First, I will introduce our main speaker from Boehringer Ingelheim. It is Dr. Ryan Johnson. Thank you so much for being here, Dr. Ryan Johnson. She is passionate about shelter medicine and has been a shelter vet for over 25 years and was the director of a large government shelter as well. She served as president of the Southern California Veterinary Medical Association and was the CE chair for California VMA. Dr. Ryan Johnson is a member of the ASV, that's the Association of Shelter Veterinarians, and AWA, which is the Advancement for Animal Welfare Administrators. Dr. Ryan Johnson also serves as the CVMA Disaster Coordinator for Orange County, California, and is one of the founding members of Southern California's Large Animal Response Team. She enjoys dressage, hiking out on the trails with friends and dogs, and paddleboard surfing out in the ocean. And I got to ask, do you paddleboard with dogs, Dr. Ryan Johnson?
Yes, in certain circumstances, I do.
That's amazing. That's amazing. That takes a lot of balance, I would imagine. And then let me introduce our second speaker, Krista Nelson. Krista is a member consultant with Shelters United. She brings extensive experience in animal welfare and vet medicine and has served as the director of operations at Stafford Animal Shelter before her time with Shelters United. She holds a master's degree in vet medical sciences with a focus on shelter medicine from the University of Florida, building on a very diverse background as a veterinary technician and adoption counselor. She is based in Montana near Yellowstone. She's an avid outdoor woman, as I can tell from talking to her. She enjoys hiking, horseback riding, and she is also a fantastic coworker. Krista is here to share how Shelters United has driven significant vaccine savings for organizations across the country. So she's going to speak on that after Dr. Ryan Johnson is done. So thank you, Krista. We're very excited to have you here. I look forward to hearing from you later. I am going to stop my sharing, and Dr. Ryan Johnson, let's hand it off to you. So if you would like to get your presentation all set up, I believe we are ready to start, and I'm very excited to hear all your important information. I'm going to hide and mute, but I'm here if you have any questions.
Okay, so thank you all for inviting me to come speak. This is one of my favorite topics. It does not sound like a sexy topic unless I like the germ taxi. I always say how not to be a walking fomite in your own shelter. So biological risk management is basically a term that basically it's about how to evaluate the risk of an infectious disease in a certain environment. And so it's a long word for that. We're going to work on what I really want to emphasize is that at the end of this lecture, I hopefully have given you the tools that no matter what bug shows up, you've got kind of a basic checklist to go through on how to counteract this, prevent this, or minimize a risk to the rest of the population. So whether you are in a $1 million brand new shelter or in like my shelter was super old, like over 50 years old, and have had thousands of animals walk through, you can use these principles to keep your animals safe. So we'll be going through like the basics of infection control, host factors, and a bunch of other things that hopefully there'll be some good takeaways for you. So we're going to start with infection control. And this is kind of important for you, whether or not, like I in my own shelter, there are times when dogs got sick, it was infectious, and we might have not known the name for it. But if you can start breaking it down to the basic principles, you at least know how to protect them. So what we're going to talk about are the basic modes of disease transmission. And then, oops, sorry, go back. Knowing how to, what's the intervention for that, how to look at the different areas and note the risks, and then perfect your own standard operating procedure. So there's something called the epidemiological triangle. And this is whether you're in human medicine, veterinary medicine, everybody uses basically the same triangle. And it basically is a model to explain the relationship between the organism that causes the disease, or the bug or the pathogen, and the conditions that allow it to spread. In essence, we're dealing with bugs, but we need to know the conditions that promote that and how we can kind of set up interventions along that path, how things are transferred, how things are going to, where your breakdowns are going to be. So, we're going to start with the first part of the epidemiological triangle, and that's basically the bug. This could be a virus, it could be a bacteria, it could be a fungus. And it's kind of important to know which one you're dealing with. Now, sometimes you don't always get that luxury. But if you do have the identification of what it is, you definitely have a better background for how you could intervene, and how it's going to spread, all those types of things. The second thing in that epidemiological triangle is the environment. So this really explains, it's a model for explaining the relationship that's causing the disease and the conditions that allow it to reproduce and spread. In essence, we're dealing with bugs, but the conditions that promote the bugs to spread and the host factors, we need to understand all that to see what makes it susceptible. So when I think of environment, I think of my own shelter, who, like I said, was very old. They now have a new one, which is great. But at the time when I was running that shelter, it was probably one of the largest shelters on the Western US, as a single location. And we had over 57,000 animals a year. 33 cities and a county. So it was huge. And when I think about the environment, I think about how many thousands and hundreds of thousands of dogs have walked certain pathways in that shelter. And, if we didn't have the protocols in place, I mean, it would just be a constant hot zone. So your environment is really important. And we'll talk about that later when we talk about disinfectants. Okay, then we have the host. So this is a relationship between the organism that causes the disease, or the bug or the virus, and the conditions that allow it to reproduce and spread. The essence of the bug we're dealing with, what are the conditions that promote that bug to spread, and what are the host factors? So, and whether or not a host is susceptible or not. If we have a pathogenic concern, we know the susceptible animals are. We know what the environmental factors are that can transfer that pathogen, and then we can use that information to break one of those sides of that triangle. So, pathogen. Let's talk about this. So infectious diseases has common denominators. They've got reservoirs, susceptible host, and limited ways they can be transmitted. So I'm going to just kind of stop here and give you a little story about early epidemiology, and I think it makes it more interesting. So as there was who is considered one of the founders of epidemiology, the study of diseases, is Dr. John Snow. So that name is really popular, I know, because of Game of Thrones, but there really was a Dr. John Snow. And he was a physician, and in London, and this certain part of London, Soho, London, was having a bad cholera outbreak. And so he did some intensive surveying of that area and was trying to figure out how that disease was spreading and who was getting it and why. So cholera is a pretty devastating disease. Water quality back in the day there was no water quality. There was no real clean drinking water, pretty disgusting. And so what he found is that there's, in a lot of villages and a lot of different areas of the city, there's a water pump, and that's where everybody in that community goes to get water. Well, what he found is that if he could take the handle off that water pump, and everybody brings their own handle, he could really break that disease transmission, because it was actually the water handle was one of the spreads one of the fomites that was spreading the cholera. So really simple thing, they didn't have to rebuild their houses or anything. They just had to know. And that was back in the day when people really didn't know how bugs were spread. They thought, I think, everything was aerosolized. And knowing, like, this handle is called a fomite. It's something that spreads disease. So something as simple as removing that handle really cut down on that cholera epidemic. So that's kind of like your reservoir. That could also be your reservoir. Okay, so direct contact with a sick animal is not the only way to spread infectious diseases. So that was my example of that. Okay, so now we're getting to the fun stuff. So we have like 5 different ways where infectious diseases can be spread. There's aerosolization, direct contact, fomite, the one I was just talking about, oral, and vector. So what you have to think about, aerosolized is, I think, one of my easiest examples. If you think of a disease you see commonly in animal shelters, the one that comes to mind first for me with aerosolization is kennel cough. And so if you are seeing kennel cough in your shelter, what's one way you can decrease that spread of transmission? And so there we go. Okay, so sorry, there's a slide that was supposed to build. Let me go back. Okay, so aerosolization, the way you would, cut that down is move the dogs farther away. It's kind of ventilation in it's ventilation and it's how close the dogs are, it's how crowded the dogs are. There's direct contact. This is, the way to prevent that is traffic flow, making sure that there's different paths through the shelter for certain things. I once did this talk in a shelter, and at the end of it, a volunteer walked a parvo dog right through the lobby. So it's kind of knowing that. Fomite, we talked about with Dr. John Snow about, certain objects. It could be, quite honestly, it could be a keyboard. It could be a light switch. Um, when I help design shelters, the one thing I really always want to see is a hand washing station before you leave a room. I'm sure it's very expensive, and I think my design sometimes gets knocked down, but if I was to have the perfect shelter, there would be a hand washing station before you left any of the kennel rooms, just so that you're not going on and from that room spreading. Oral, unfortunately, dogs are not always selective in what they choose to eat. Common way to get, parvo or other diseases. And then vectors. I was just in the South last week. We were flying some dogs to the northeast, and 10% of those dogs had heartworm. And they had heartworm because, the shelters are really challenged to provide disease control and provide preventatives. So, sometimes it could be as easy as fixing the screen in your shelter and not let the mosquitoes in. So different ways infectious diseases spread. Okay. So let's take this as an example. So you got 2 of these dogs, kind of husky dogs, right next to each other. If we think about it, if they had, kennel cough, yes, this would be they would be transmitting it back and forth. If they had Lyme disease, would you be worried? Well, you got to think about how Lyme disease is spread. It's spread through ticks. So I'm not quite as worried. But parvo, yeah, there's, parvo could be spread fecal orally. It could be spread, it can be transmitted aerosolized. It could be someone came in and use the same feed bowl or whatever, those types of things. So look at the idea behind this presentation is to help you look at your shelter with fresh eyes and see where you may have some issues and how to kind of mitigate those issues. So infectious diseases, I mean, overcrowding is like one of the number one reasons why we get infectious diseases can take a life of their own. Stress. I always think of herpes virus with overcrowding and stress. Unsanitary conditions. If the water you're using to mop your floors is the water in your bucket's dirtier than the floor, that's not a good plan. Mop buckets I like to have cleaning stations that stay in a certain area and aren't aren't run through the whole shelter. Same thing as food carts and same thing as laundry, because otherwise you've just got, rolling fomites running through your shelter. And then having a plan for addition of new animals. Now, again, in some shelters that could be a luxury, but putting them in an area where they can be monitored for a while before putting them in the main population is always helpful. But again, it could sometimes be a luxury. Okay, so airborne, what are we going to do? We're going to increase distance and ventilation. Direct contact, we're going to work on traffic flow. Fomite, we're going to clean and we're going to hand wash and we're going to use the proper disinfectants. Oral, we're going to clean up. We're going to eliminate biological waste and vector. We're going to, have some type of ectoparasitic control. My shelter, again, this is millions of years ago. There were certain cages we would put the dogs in and we would adopt them out. And 3 days later, they would come back covered in ticks. And this is in the 90s. It's a long time ago. And it was before we had all these wonderful different parasiticides. And they were testing Frontline at the time. And so we were like one of the testing grounds for Frontline. And that was such a game changer because it was really, it was horrible for the dog, horrible for the new adopter to, suddenly have, hundreds of ticks pop up on their dog. Okay, so environmental control. What is that? Well, called the 4Ds: dirt, disease, disinfectant, and dilution. So you can have the best disinfectant, expensive disinfectant, or bleach, and you could pour it on dirt and you are not disinfecting. So it's really, really important to know that you must clean first and get the organic material out and make it's a clean, pristine surface. And the reason why is the disinfectant wasn't made to work on like that organic material. So it's really important to know that. It's also important to know what disease, if you have that, again, have that luxury, what pathogen are we targeting? Because we want to make sure we're going to use the right disinfectant. And disinfectants can be pretty solution specific. So it's really important to know how to use that disinfectant correctly and at the correct dilution. Because otherwise you're just using expensive product that may not be doing its job because it's being too challenged. So it's really important to know how to use, to use the appropriate disinfectant. You can under dilute and you can over dilute. And under diluting, you're not going to be doing anything. You have to clean those dirty surfaces. This fourth bullet about insufficient amount of disinfectant applied or surface not thoroughly covered. If you go into any veterinary suite and you look at the surgical table and maybe spray it down with your disinfectant and watch where it rolls to. So it's really important to see. A lot of things are not level. And so you may not be contacting the whole equipment piece. So it's really important to kind of make sure that you're getting the whole surface while you're disinfecting. It's also important to make sure you're doing it at the right dilution. We've got some expensive disinfectants, and they can be used at different strengths to do different things, like a clean versus a disinfectant. Temperature and humidity. This one's really important. For example, I was out in Florida 2 weeks ago, and I was watching the kennel workers dry the walls. Now, that's something we would never do in California. We have a kind of a much more drier climate, but it's really important that they were drying the walls because that humidity is not helping that disinfectant do its job. And then lastly, remember to use enough contact time. So make sure you're reading the label and doing it correctly. The other thing is to make sure you know what you're trying to kill. So we start at the top and go down from easy to hard, and then the different types of components. Now, this is kind of an eye chart for you, but basically it was created after 9/11 and biological warfare was, kind of like the hot topic then. And so this chart was made way back then to help protect food supply and other things. But I found it really useful because it shows that there's a lot of products that we've had in the past that may not necessarily have been able to kill parvo. So it's really important to know what you're using. I think the most common things people are using right now are accelerated hydrogen peroxides. In the past, in my early days, it was bleach. And bleach was all we had at the time. Well, we had Rocal, but Rocal, like I said, is not always going to hit the right pathogen. But it was really important to know what was the correct dilution for the bleach. It was a 1 to 32. But, it was also very hard for the cats. It's caustic, it's hard on equipment, it's hard on nasal passages, it's hard on employees, it's hard on your clothes. So when rescue came out, it really seemed to be just a breath of fresh air, a new way to do things. And I'm sure there are other things that are out there now. So this is talking about that. Okay, host factors. So how do we keep dogs and cats healthy? So it's a series of things that you need to employ in order to keep that population healthy. And using, the basics of biological risk management, using the proper disinfectant and making sure they're protected with vaccines really helps you ensure the health. You get a head start on that. So what do we need to know about vaccines? So there are different guidelines you can find in different places. I'm going to kind of go through this pretty quick, but vaccines are either inactive or killed, or modified live, or recombinant. So usually an inactive or a killed vaccine, let's say we're going to talk about cats. So let's say we're talking about FVRCPs. A killed vaccine, generally, you'll need 2 doses. And the problem with that, for example, if you're trying to prevent panleukopenia, you need fast. You need a modified live, and a modified live will work much faster after 1 dose. Now, when we talk about recombinant is, we've got a recombinant leukemia, we've got a recombinant rabies, and we've got a recombinant distemper. What the recombinant vaccine is, they basically have isolated what proteins in that virus cause the disease. And they basically kind of cut them out, put them in a different type of vector form. In this case, it was canary pox. They grow it up and they make a vaccine out of it. So the animal thinks they're seeing the whole virus, but actually they're only seeing two little protein pieces in some cases. And they're able to respond to those protein pieces without seeing the whole virus. So it was a really clean way to start making vaccines. And it probably been existing well over 25 years. So it's not exactly new, but it is, some people are still not as conversant on it. Okay, so there we go. We've got our distemper, we got our adenovirus, we've got our parvo, and we've got our bordetella. In the past, I think when bordetellas first came out, there were some that were injectable, and then we got the intranasal, and then we've got the oral. So really what the experts will tell you is it's more of a mucosal disease. So you want to put the vaccine where the mucosa is. So whether that's the buccal cavity of the mouth or intranasally in the nose, that you get a faster speed of action on that. Okay, rabies is inactivated, and there's a reason for that. So rabies is a killed or a recombinant vaccine. Back in the 70s, they had modified live rabies, and it was early days of creating clean vaccines, and there were some litters of kittens that actually they got rabies from the vaccine. So we don't really hear about that anymore because rabies, I think since the 80s have been a killed vaccine until I think in the 90s is when recombinant came out. Okay, kennel cough, talked about that a little bit. Okay, when to vaccinate. Now there's some interesting discussion about this right now, but basically, first of all, shelters have a little bit different timeline on the vaccines than a normal general practice. And the reason for that is they're dealing with a stressed animal. They're, that aren't in a loving home yet, but they're not, hopefully a loving shelter that is doing the best they can, but they've got a huge population, and it's It's very stressful for the animals. So in shelters, we vaccinate them every 2 weeks. Now, if an adult animal comes in, usually what they'll do is they'll vaccinate them and then revaccinate them 2 weeks later. With kittens, generally they start at 4 weeks of age and then do it every 2 weeks until they're, roughly 20 weeks old. Now, there is some recent discussion about vaccinating them immediately. And I don't really have an opinion on that because I haven't seen data that would approve that. I think some shelters are saying that they're having really good luck with it. Again, it's all anecdotal, so I don't really have anything factual to tell you. But I am very comfortable with 4 weeks and up. Same thing as the canine distemper, adenovirus, and parvo. The perfect world is to vaccinate them on the trucks if you can, but vaccinate them immediately on intake, both cats and dogs, because it does take their stress, they're immunocompromised. It does take a little while for them to, it's not immediate. It's going to take a little time for that vaccine to work with the immune system. And then there's some dogs, and we're going to talk, that don't respond. When parvo first came out, back when I was in high school, we used cat vaccines because we didn't have parvo yet. We didn't have a parvo vaccine. So the panleukopenia virus was very similar to the parvo virus. So back in the day, we were actually giving cat vaccines to dogs to protect them. And that was when they would say, oh, black and tan, those are the ones that parvo was really harsh on, with like the Dobermans and the Rottweilers. So it was really kind of interesting how that's all evolved. Now, parvo vaccines now are extremely effective. Everybody makes a great parvo vaccine. So we're very lucky that we have that. But this is a day I think everybody forgets that happened in immunology and vet school, is that there are different people, different animals respond to vaccines differently. And so if you have good antibodies in the dam, the mother, whether dog or cat, they give colostrum to the babies. So that first milk, and it's very, very protective. And what happens though is it can actually block an immune response. So what happens is, let's say you have these all these dogs in a room and you just vaccinated them, and they do have maternal antibodies through their colostrum. Well, at 8 weeks of age, only like less than a quarter of them will actually respond to that vaccine. The rest are being blocked by the maternal antibodies. And so if you go to, now we're going to go to 12 or 11 weeks of age. Now we have some that the colostrum antibodies have worn down, but we still have this big population who are protected through the maternal antibodies, and that vaccine can't get through. And we're going to go to 14 weeks. Okay, we have less. 17 weeks, we got one holdout here. So that's why they kind of made a generalization of vaccinating every 2 weeks, because we want to make sure that the minute those maternal antibodies are no longer effective, that we can protect them with the vaccine. So I hope that makes sense to you all. But that's why we go out longer, like for example, with parvo. We'll try to go out 20 weeks with parvo, just in case those maternal antibodies, which if you think about it, it's opposite of what you would think. But if you live in a very parvo area, there's chances that dog is being like inoculated on the street corner when you take him for a walk, or he's boosting his titer type of thing, because it's in the environment. It's almost like giving them a natural vaccine. And so those make pregnant moms, have high colostrum response. So they can be blocking them for quite some time. Not everywhere, now if the mom is really compromised, she might not be as good at blocking those maternal antibodies. And again, that's the argument for starting them young. Okay, so in most situations, and definitely as a standard, is to vaccinate at admission, again, with a modified live for speed of action or the recombinant. And rabies, I think this is more of your choice. Some shelters vaccinate on intake, some vaccinate on release. The shelter I work for vaccinated on release. We were in a very high rabies area too. So just to kind of take that into consideration. Okay, so shedding. What is shedding? Well, shedding is it when the virus or bacteria is leaving the host and they're entering the environment and they're infecting other hosts. So here's some of our common pathogens for dogs. We've got parvo. It could be incubating for 2 weeks or more. Distemper, this one I hate. It's like greater than 6 weeks. The shedding period could be 4 months for distemper. Now, going back to parvo, you could see that the shedding period is 2 weeks after signs resolve. That's why they want you to bathe the dogs before they leave, because if it's on their hair and their coat, they can still be infectious to other animals. Adenovirus, less than a week, 2 weeks. We don't worry about that one as much. Parainfluenza, kind of same thing. And Bordetella. Bordetella is kind of the interesting one too, because it's kind of the dog park one where the dogs get it. The pharmacologists in veterinary medicine are now recommending not giving antibiotics to Bordetella because it is a virus, but that your shelter has to make that decision because it's probably more common in a shelter environment for a secondary bacterial infection to happen. So general practices may not always treat a kennel cough, but a shelter generally will just because they're really trying to protect the environment. And then panleukopenia, again, not our favorite one. The incubation period could be less than 2 weeks, and 2 weeks after signs resolve. There's more and more success with trying to get kittens through panleukopenia. It is a tough disease on them. Calisi, that one, unfortunately, you can usually see because it really affects their eyes and their tongue and their mouth. And then herpes. Herpes is really the best way to get your herpes down is de-stress the environment. And that's by calculating what your capacity is for that cat room, making sure the animals have enough space, the portals and that 9 square feet of space. All those things are really important for keeping that disease down. You can have the cleanest protocols and the best staff in the world, but if you are overcrowded, you are going to see herpes. And I'm speaking from experience. Chronic shudders, hard to see. They can be spreading disease through your facility. And that's why, when we talk about biological risk management, we're looking at all the different factors. So if we can minimize one or two of them, your job hopefully will be, and your disease outbreak will be less. So in other words, you can mess up your biological risk management even if you're doing everything right. Okay, so I hope that was helpful. One of the things I really want to make sure you know is that whenever I'm looking at a disease outbreak, what I do is I backtrack and I have the shelter show me how the animals come in through, intake, whether they're coming off a truck or coming through the front counter. And I follow and I just ask questions, kind of annoying, but it kind of starts to understand where your risk is. So for example, there's a shelter I was consulting on that was having terrible distemper and parvo. And so we started in the trucks. Well, first thing that would happen is the dogs came off the trucks and they would walk by all the clean food bowls. So what do dogs do when they see racks of stuff? They sometimes pee on them. So one of the easy things, we didn't have to blow up that shelter. All we had to do was change where the food bowls were kept. The other thing we found out by, again, asking annoying questions was they were not cleaning the trucks in between picking up animals. And so, basically those dogs were like cooking in a very diseased environment and just simply cleaning those vehicles and cleaning them thoroughly, letting them dry before you go pick up another dog or cat. Super helpful in breaking that cycle. So that's why I think it's really important to kind of go through with fresh eyes. Making the other kind of key things are like making sure your hand washing stations have paper towels and soap. I mean, it's so common to go into a shelter and there's no soap. So, again, you can't break that cycle if you're the walking fomite. Foot baths, those are kind of controversial. Basically, once you step in a foot bath, you've kind of inactivated everything. Foot baths to me, they remind people there's disease coming up, but they're not effective unless you've got someone standing there and changing out that foot bath. Now, one time I came into my shelter and overnight there were 250 fighting roosters that were added to all the dog cages. And so the first thing you do is panic because it was an exotic Newcastle outbreak. But then you just remember, okay, how does it spread? What's this virus like? How can I cut down? What are the different things I'm going to do to make sure that it doesn't spread through the shelter? So no matter what you're up against, even if you don't have a name for it, you've got the basics to think about how viruses are spread, how to use disinfectants correctly. Looking at foot traffic, I think, is so important. So it doesn't mean you need a nice shiny shelter, which would always be wonderful. I think before anybody moves into a new shelter, going through and reviewing how disease is spread is so important, because it's not just you're relying on the new shiny shelter, it's really your protocols, your cleaning protocols, your disinfecting protocols, your vaccination protocols, and the flow is so important to that. So I am finishing with that on my soapbox. Thank you all for listening, and I'm going to turn it over now to Krista.
Thank you, Dr. Ryan Johnson. Especially those tips at the end are really helpful, I think, for our constituency. So thank you so much for all your knowledge, all your expertise today, and helping us teach us all how to keep pets healthier and safer, including the ones that have to meet their new adopted friends. So it's not just really shelter pets, but it's also community pets as well of the adopting families who need a meet and greet. So I think that's very amazing. Okay, so I'm going to share my screen really quick, and I'm going to invite Krista to pipe up. And before we wrap it up, we're just going to talk about the Shelters United and pet vaccine program collaboration with Boehringer Ingelheim. So Krista, if you would like to speak to a little bit about that, and then we'll close it off.
Thanks, Marcy, and Dr. Ryan Johnson, thank you. Everything you shared was so incredibly helpful and applicable. I'm hoping everyone's going to be able to take all of this information and just implement it right away. So Dr. Ryan Johnson just walked us through why vaccination is such a critical part of breaking the disease cycle. So really the next question is, how do organizations actually make that level of protection achievable every day? And that's where Shelters United comes in. Through our partnership with Boehringer Ingelheim, we're able to offer their high quality vaccines at up to 65% off regular pricing. And that's not just a discount. This is what allows organizations to actually implement the kind of vaccine protocols that we just learned about. Because the reality is really simple. Preventing disease is always easier and less disruptive and far less resource intensive than responding to an outbreak once it starts. What makes our program especially practical for organizations is the flexibility that we're able to offer. There's no intake restrictions, there's no minimum purchase requirements. So whether your intake numbers are steady or unpredictable, you're still able to vaccinate appropriately without having to adjust your care based on budget thresholds or timing. Shipping is also completely free, so just removing another barrier there. And our vaccine program is already making an impact. So far, our members have saved over $140,000 in vaccine costs since we launched this program back in December. So really, this program is all about making sure that what you just learned from Dr. Ryan Johnson isn't just best practice in theory, it's something that you can actually sustain in practice. If you want to get going and get started with this vaccine program, you can visit us at sheltersunited.com/vaccines. Marcy, you can go to the next slide. And then I do just want to zoom out from vaccines now, because this is really where Shelters United as a whole comes in. Shelters United offers a completely free membership program that helps animal welfare organizations save money on all the essential supplies, find new ways to generate revenue, and access tools that help you run more effectively overall. We offer 5 programs that are designed to support organizations across multiple areas of need, from medical care to daily operations. And a big part of that is giving our members access to everyday discounted pricing on essential supplies. This is going to include vaccines, preventatives, diagnostic tools, medications, cleaning supplies, and lots of other high use products that you rely on every day. On top of that, there are manufacturer discounts, which help to stretch budgets even further. And just as importantly, there's real support behind this. The Shelters United team is here to answer questions, troubleshoot challenges, and make sure that you're getting exactly what you need. Because at the end of the day, this isn't just about lowering costs, it's about making it easier for organizations to consistently access what they need in order to do the work well. And our impact is significant. In 2025 alone, our members saved over $13 million in supply costs. And what that really translates to is more capacity, more flexibility, and more ability to say yes to animals in need. Marcy can go to the next slide. Okay. So if you're thinking we want to implement everything we just learned today, but we need it to be sustainable, then joining Shelters United is a very simple next step. Membership is free and it gives you access to our programs, resources, and support. You can visit our website, sheltersunited.com, or reach out to us anytime via email or a phone call. And I just want to quickly acknowledge too, this work is constant. Disease prevention in animal welfare, it's not a one-time fix. This is something that you need to be managing every single day. So our goal at Shelters United is simply to make that process easier by removing barriers, reducing cost, and helping teams stay consistent where it matters the most. And back to you, Marcy.
Awesome. Thank you so much, Krista. And I really appreciate Dr. Ryan Johnson and the team at Boehringer Ingelheim in supporting this webinar and this education. They're really committed to animal shelters and animal rescues, community shelters, spay neuter clinics, all of that, all our membership. And I just really appreciate it. So thank you for watching. We appreciate all you do for animals, all the work you do in community and your neighborhoods. You're welcome to follow us on Facebook and LinkedIn. If you need us, we're always here at our website, sheltersunited.com. And we hope you have a great day and we'll see you in the next webinar. So,